the perspective of a public health practitioner, those folks are more boots on the ground, so they're working with communities and people in the places where they live, work, play, worship, shop, to really try and help make the healthy choice the easiest choice. And so we're mobilizing communities to try and make changes such as increasing access to healthy food, improving opportunities for physical activity, and doing that all working with communities. I think we are recognizing more that it's so closely correlated with the place that you come from. I think we're recognizing more the role of the built environment, which we think about, if there's crime or if there's just, boarded up buildings and you don't feel safe being out walking and moving, people are not going to exercise. Education is probably one of the biggest predictors of health, yet there's so many communities where people with limited income, and especially communities of color, that are not getting the educational opportunities that they need. The problem is that we're not focusing on these things enough, and instead we're looking at what do individuals do? What do individuals need to do to change? And we're sort of blaming them for saying, well, it's this person's fault that they're sick because they chose not to go to the doctor or they chose not to eat healthy. And we don't look at the bigger picture in terms of understanding that, maybe there isn't a health clinic in their community. Maybe they don't have a place to buy healthy food. Maybe they don't have a place to exercise. And it makes those things a lot more difficult. When a child's growing up in poverty and they don't have the same access to education, they don't have the same access to healthy foods or maybe medical care, they're living in substandard housing, so their risk for lead poisoning and asthma are going to be higher. And so as they grow up and they are at higher risk for obesity and other chronic diseases, and those things track into adulthood. So anywhere in the world where people are facing poverty and facing inequities, you're going to see this same cycle and this same concern that children who grow up in poverty become adults who have these diseases and problems, and then trying to get ahead economically can be challenging when you're facing health issues. There are a lot of things that can be done on a community level to make improvements, and you just think about something simple like, for example, in Buffalo we're working with the Healthy Corner Store initiative. So let's say we have one small corner store, and that corner store decides, I'm gonna clean up the front of my store, I'm gonna make it more presentable, I'm gonna put some fruit and vegetables out there and give some healthy options for people in this community.